Hello everybody. It gives me great pleasure to be presenting at this conference. My name is Dr. Zahra Mansour. I am currently a physician working in Dubai. I will be presenting a systematic review that I conducted in the vascular surgery department during my internship, titled Predicting Amputations in Patients with Diabetic Foot Ulcers. I hope you enjoy my presentation. The reason I picked this topic is that it is a highly prevalent issue. Nearly a quarter of the population of diabetics develop a foot ulcer. 12% of those require an amputation. Diabetics with foot ulcers have an 8-fold higher risk of a lower extremity amputation compared to non-diabetics. Besides that, as shown on the graph, 50% of diabetics who undergo amputations die within 5 years. It increases disability, reduces the quality of life, generates undesirable psychological impacts, increases medical costs, and creates a massive economical load on the healthcare system. Furthermore, there is a lack of a standardized predictive model that is used among healthcare professionals to predict the risk of amputation. And the current guidelines for prevention do not incorporate the predicators found in different studies and articles. The systematic review aims to predict the strongest factors that can anticipate the risk of amputation in diabetic foot ulcers, for it to be treated and reversed before permanent damage occurs. So we aim for early identification of risk in order to optimize the management strategies. Regarding the methods, the systematic review was performed based on the guidelines in the PRISMA 2009 checklist. Medline database was searched for English articles reporting risk factors of amputations in diabetic foot ulcers published in the past 10 years. First, 3 searches were conducted in Medline, using 3 different search terms. Then the results of all 3 were combined. After the removal of duplicates, the remaining articles were assessed by screening of titles to determine the potentially relevant studies. The selection of articles was based on the presence of 3 main key terms: risk factors, amputations, and foot ulcers. The search findings were then narrowed down, and the abstracts of the identified studies were evaluated for eligibility through the inclusion criteria by 2 reviewers independently. At last, the final studies that met the inclusion criteria were assessed for quality using the Newcastle-Ottawa Quality Scale for non-randomized controlled trials. The articles that received less than 5 out of 9 in the quality assessment were excluded. All the other articles were included in the systematic review. 2 review articles were screened during this search. The criteria for including the studies included published observational studies, English articles, studies that are published in the past 10 years, type 1 or type 2 diabetic population, all patients that presented with an ulcer at the time of the study, the primary outcome was amputation, all the studies that tested the risk factors of amputation, and any sample size. The study selection strategy was applied on 832 articles as shown in the figure. 11 articles met the inclusion criteria and were further evaluated by the Newcastle Quality Score. Finally, 7 articles were selected for the systematic review by 2 reviewers. The systematic review consisted of 7 articles reporting on 3,481 patients. 4 studies were cohort. 1 study was case control and 2 studies were cross-sectional. All the studied population involved patients with type 1 or type 2 diabetes presenting with a foot ulcer, and the sample size ranged from 94 in small studies to 837 in large studies. The mean population size was 497.2 patients. 917 patients were identified as the amputation group. The indication of amputation were classified into 4 categories and retrieved from this group. The mean age of the amputation group was 60 years and above, with males being the predominant gender. Further data regarding the incidence of amputation and overall amputation rate were either documented or calculated from every study. The overall amputation rate ranged from 3.3% to 42.8%. The risk factors extracted from the results section were part of 4 categories: history and physical exam, ulcer characteristics, lab results, and comorbidities. All of the data extracted were in the forms of odd ratio, 95% confidence interval, and predictive value. The mean values with standard deviation of the included risk factors were recorded when available, and the incidence of risk factors among the amputation groups were identified or calculated when the data was sufficient. This slide shows the strongest predictors of amputation and the number of articles they were identified in. Regarding history and physical examination, 6 articles identified high white blood cell count as a strong indicator. 5 articles identified low hemoglobin, and 4 articles identified low albumin. Regarding history, 2 articles equally identified hypertension, duration of diabetes, and smoking as strong predictors. High ulcer grade was also found to be strongly related to amputations in around 4 articles. All of the included studies tested the influence of age, gender, smoking, and duration of diabetes on the outcome of foot ulcers. Most of the amputated patients were in the age group of 60 and above. According to the odds ratio and p-values, only 2 studies provided evidence that the risk of amputation increased with age. Besides that, a statistical significance of both smoking and the duration of diabetes was displayed in 2 studies only. On the other hand, the BMI of patients was calculated in 1 study only, and it appeared to be significantly lower in the amputation group. As shown in the slide, the risk factors highlighted in red resemble what this systematic review identified as the most significant risk factors used to determine the risk of amputation in patients with foot ulcers. Finally, 10 risk factors were acknowledged as the strongest predictors of amputation. The high postprandial glucose, elevated white cell count, low hemoglobin, low albumin, high CRP and ESR, neuropathy, osteomyelitis, and Wagner grade more than 3. Evidence regarding other risk factors was insufficient to derive a definite association. Most of the studies included in the review displayed an absence of any valid association between demographic factors and amputation. In the lab results category, 6 factors appeared to be effective in predicting amputations: white cell count, ESR, and CRP, as markers of infection and inflammation, are strong indicators of amputation. High levels appear to be associated with treatment failure in diabetic foot ulcers. Moreover, factors like low albumin and hemoglobin indicated poor nutritional status and delayed wound healing, therefore aggravated the risk of amputation. The shortcomings of this review included missing data, other factors such as the cause, location, site and size of the ulcer, alcohol, BMI, and foot deformity were not included in the analysis because the data were insufficient. Furthermore, there wasn't enough information to calculate the sensitivity, specificity, and likelihood ratio of the predictors and the diagnostic test. The heterogeneity was evident as the studied population differed in their size and characteristics. Finally, the review did not take psychological and behavioral factors into consideration in terms of their influence on the patient's progression. So I come to the end of my presentation. I really hope you guys enjoyed it, and I am welcome to any questions.